We're talking with Dr. Aamir Khan, Executive Director of Interactive Research and Development. Dr. Khan, what are the worst regions in the world right now for MDR-TB?
The worst regions for the world are likely Eastern Europe and Southern Africa for MDR-TB. A lot of this is because of historical reasons. In Eastern Europe, there's been the use of regimens, TB drug regimens, that haven't been conducive to good outcomes, that have sometimes resulted in the development of MDR-TB in patients that would have had susceptible TB when they began treatment. There's also in Eastern Europe the historical preference for institutionalization, meaning putting patients into hospital wards. And in many times in cold environments, the ventilation in those rooms, in those wards, aren't effective, and there's transmission between patients of MDR-TB, between patients and also to health staff. There's also prison systems in the former Soviet Union countries, but particularly in Russia, which have had a demonstrated epidemic of MDR-TB among prison inmates, in some instances, which was eventually controlled very effectively in the region of Tomsk in Siberia by proper identification, treatment, and the separation of patients that were infected.
Mm-hmm. Let's move on to XDR-TB. What alarms you most about the changes in XDR-TB?
I think the lack of new drugs that are going to effectively treat patients reasonably quickly is what alarms me most about XDR-TB. We have a couple of new drugs that will help improve treatment in these patients, but as we go forward, we're going to need more drugs. We're going to need more drugs that are effective in helping us shorten the regimens. Currently, the treatment regimens are just far too long. It takes up to 24 months to treat these patients. And we're going to need drugs that are also less toxic. By that, I mean that they cause less side effects. And the lack of investments in drug development in the past has really resulted in the situation we have. But there's hope. There are some new drugs in the pipeline, and we think that in the next few years, we're going to be seeing drugs that are going to help us achieve that objective: shorter duration of treatment and less toxic drugs.
And why do you believe the TB community has not been an effective advocate in the last decade or two?
I think we have, I think the TB community has really been focused on preventing susceptible TB, which is appropriate. But at the very early stages, we were aware that drug-resistant TB also existed in the same countries that we were rolling out what are called the DOTS programs. In those early days, there was a sense on some people's part that the treatment of these drug-resistant TB cases would be too expensive, would be too challenging in some of the environments that these patients were accessing care, and therefore perhaps that should not be the focus of TB control, and that we should keep focus on susceptible TB. And I think that was a mistake, and many of us, when we look back in hindsight at the policies that existed, at the recommendations that were being issued, at the programs that were implementing and focusing on DOTS, those were all appropriate from the perspective of DOTS, but we knew even at that time, of course, that we had these patients with drug-resistant TB. Had we done more about that earlier on, we would not be facing the MDR-TB crisis that we are now.
Do you think some of the funds that have gone to TB programs have been inefficiently or ineffectively used?
I think when we keep doing the same thing year after year after year, even if we're using funds appropriately in terms of how a donor may want us to use them, it is ineffective use of those funds because there's so much more that we could be doing and should be doing. Now, having said that, at this point in time, there is a very large funding gap in global TB control and in global TB research. And without that investment, I think the arguments for inefficiencies are, they're important, but what really is something that we should focus on is the inadequacy of investments in global TB control and global TB research.
Thank you, Dr. Khan.
Thank you.